Good morning, I'm Gabrielle, Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of assessing the abdomen. This is the physical examination of inspection, auscultation, percussion, and palpation. So, sir, I am your nurse for today. What is your name? I am going to assess your abdomen. Is it okay with you? Will you cooperate with me? Before that, we need to prepare all the materials needed, the stethoscope and the tape measure. And then, before the procedure, you need to perform hand washing and provide for clients privacy like closing the doors and windows. Before that, I ask my patient to pee because I'm going to depalpate his abdomen. Now that the patient is ready, I'm going to inspect the abdomen to check if there is any pain or guarding the patient's face. After observing that my patient has no feeling of pain. After that, I'm going to observe the abdomen from ribs to the symphysis pubis, and I will observe if there are presence of striae or stretch marks, hematoma, and scars. I observed that my patient has no presence of striae or stretch marks and any scars, and the shape and size of the abdomen of my patient is round. Next is the assessing the umbilicus. It should be inverted and in the midline coinciding with the mid-sternal line. I observed that my patient's umbilicus is inverted and no discolorations present or the Cullen sign, and it is in the midline. Next is I'm going to measure the abdominal girth of my patient using the tape measure by placing it on the umbilical line that runs throughout the anterior and the posterior. The measurement of the umbilical line of my patient is 96 centimeters. Next is the auscultation. I'm going to auscultate the 4 quadrants of the abdomen of my patient using the diaphragm of the stethoscope starting from the right lower quadrant. The sounds are present and seems to be normal, and there is no presence of hyperactive sounds or peristalsis. And now I'm going to listen for the vascular sounds of the abdomen of my patient using the bed of the stethoscope. It should be in the following sequence: the aorta, renal, iliac, and femoral. The sounds are normal peristalsis, and there is no presence of vascular bruits and chronic abdominal pain. Next is will do the percussion of the abdomen to know if there are presence of fluid, distensions, and masses. Then I will perform percussion in the right upper quadrant, starting from the mid-clavicular line going down, then repeat at the other side. After the percussion, I observed that there is no presence of fluids, distensions, and masses. After that, I will going to percuss the liver of my patient on the right side and the spleen on the left side, starting from mid-axillary line, going down to the lower intercostal line. By asking my patient to take a deep breath. So, sir, can you turn your body into right side? And now, sir, can you turn your body into left side? After percussing the liver and spleen, I observed that the sounds of liver is dullness and the spleen is tympanic. Next, I will proceed to the palpation. First, I'm going to do the light palpation using the pads of my fingertips, beginning with the non-tender quadrant up to the rest of the quadrant by gently depressing it at exactly 2 centimeters in the dipping motion. Then I will remove my hands and go to the other areas. After that, I will perform the tip palpation in about 4 centimeters. As I do the light palpation, there is no tenderness and presence in the abdomen of my patient. As I do the deep palpation, there is no presence of lumps and masses, and it is soft and non-tender, and there is no presence of cirrhosis and tumor. Next is I'm going to palpate the kidney of the abdomen by using the bimanual palpation. And I am here in the right side of the patient, and I'm going to capture the kidney by pressing my hands together as the patient's breathe. And do it on the other side. As I palpate it, there is no tenderness present, and it seems that there is no presence of hydronephrosis or enlargement of kidney. Next is I'm going to palpate the right lower quadrant up to the right upper quadrant of the liver of my patient by hook palpation. As I do the hook palpation, I observe that there is no tenderness or muscles at the abdomen of the patient. Next is I'm going to palpate the spleen of my patient on the left side, which I am on the right side, and placing my right hand in the back of the patient's abdomen and the left side at the right costal margin. As I palpate it, it seems to be normal and no tenderness and enlargement of the spleen. Lastly is I'm going to palpate the umbilicus areas. As I palpate it, I observe that it seems to be normal and no swelling, bulges, or masses. I am done in assessing the abdominal part of the patient, and it is important to perform hand washing again and document all the procedure you've done. Again, I'm Gabrielle Baliton. Thank you.